we are going to see the histology of esophagus. The esophagus, which is the first part of alimentary canal, represents a muscular tube that conveys food and other substances from the oropharynx to the stomach. The mucosa that lines the length of the esophagus has a non-keratinized stratified squamous epithelium. The underlying lamina propria is similar to the lamina propria throughout the alimentary tract. Diffuse lymphatic tissue is scattered throughout and lymphatic nodules are present. The deep layer of the mucosa, which is the muscularis mucosae, is composed of longitudinally organized bundles of smooth muscle fibers. The submucosa consists of dense irregular connective tissue that contains the larger blood and lymphatic vessels, nerve fibers and ganglion cells. The nerve fibers and ganglion cells make up the submucosal plexus, that is the Meissner's plexus. The muscularis externa consists of two muscle layers, an inner circular layer and an outer longitudinal layer. The upper one-third or proximal one-third of muscularis externa consists of striated muscle, a continuation of the muscle of the pharynx. Striated muscle and smooth muscle bundles are mixed and interwoven in the muscularis externa of the middle third of the esophagus. The muscularis externa of the distal one-third consists only of smooth muscle, as in the rest of the digestive tract. External to the muscularis externa is the adventitia, and it consists of dense connective tissue. A cross-section of the wall of the esophagus is shown here. The mucosa consists of stratified squamous epithelium, which is shown as EP in this diagram, and deep to that a lamina propria and muscularis mucosae. Lamina propria is shown with LP and muscularis mucosae with MM. The boundary between the epithelium and lamina propria is distinct, although uneven, as a result of the presence of numerous deep connective tissue papillae. The basal layer of the epithelium stains intensely, appearing as a dark band that is relatively conspicuous at low magnification. This is the layer we were talking about. This is the highly stained area. And this high staining is in part due to the cytoplasmic basophilia of the basal cells. The basal cells are small, which results in a high nuclear cytoplasmic ratio, which further intensifies the hematoxylin staining of this particular layer. The submucosa, it consists of dense irregular connective tissue that contains the larger blood vessels and nerves. No glands are seen in the submucosa in this diagram, but they are regularly present throughout this layer and are likely to be included in a section of the wall. Whereas the boundary between epithelium and lamina propria is striking, the boundary between mucosa and submucosa is less well marked, although it is readily discernible. The muscularis externa. It is composed largely of smooth muscle, but it also contains areas of striated muscle. Although the striations are not evident at this low magnification, the more densely stained eosinophilic areas, which are shown by asterisk, over here you can see the multiple eosinophilic areas at the region of asterisk. They prove to be striated muscle when observed at higher magnification. The inset over here shows circularly oriented striated and smooth muscle. The striated muscle stains more intensely with the eosin, but of greater significance are the distribution and number of nuclei. In the center of the inset, that's over here. Numerous elongated and uniformly oriented nuclei are present. This is smooth muscle. Above and below to this, few elongated nuclei are present. Moreover, they are largely at the periphery of the bundles. This is striated muscle. The cross striations are just perceptible in some areas. If you focus over here, these areas, you can identify the cross striations. The specimen shown here is from the middle of the esophagus, where both smooth and striated muscles are present. The muscularis externa of the distal third of the esophagus would contain only smooth muscle, whereas that of the proximal third would consist of striated muscle. External to the muscularis externa is shown over here as ME, and external to this layer it is the adventitia, and it consists of dense connective tissue. This diagram shows the magnified view of the mucosa. As in other stratified squamous epithelia, new cells are produced in the basal layer. In this diagram, this is the basal layer. And from this area, the new cells will move to the surface. During migration, the shape and orientation of the cells will change. This change in cell shape and orientation is also reflected in the appearance of the nuclei. In the deeper layers, or you can see it over here, the nuclei are spherical, and in the superficial layers, that is over here, or this area, you can identify more elongated and parallelly oriented, parallel to the surface, parallelly oriented nuclei in the superficial layers. Those nuclei that can be seen throughout the epithelial layer, particularly the surface cells, indicates the epithelium is not keratinized. Till the surface you will be able to identify the parallelly arranged, parallelly lying nucleus. In some instances, the epithelium of the upper regions of the esophagus may be parakeratinized, or very rarely there can be keratinized. As shown in this figure, the lamina propria, which is shown over here, is a very cellular, loose connective tissue containing many lymphocytes, small blood vessels, and lymphatic vessels. The deepest part of the mucosa is the muscularis mucosa. It is shown here. That layer of smooth muscle defines the boundary between mucosa and submucosa. The nuclei of the smooth muscle cells of the muscularis mucosae appear spherical because the cells have been cut in cross section. So that was in general regarding the histology of esophagus. We will see the remaining histology of the further continuation of the gastrointestinal tract in the coming videos. Thank you for your patient listening.